And tonight, scientists are closely watching the BA.2 variant, also known as stealth Omicron. A new study finding that it's more severe in children than previous variants. Researchers also compared the outcomes of hospitalized children with COVID-19 and parainfluenza and the flu. And here to explain the findings is our chief health editor, Dr. Partha Nandi. Dr. Nandi, looking at this study, which virus hit the children hardest, coronavirus or influenza or the flu?
So Glenda, first of all, the study took place in Hong Kong, and the data is preliminary, right? But researchers found that kids hospitalized with this BA.2 variant were more likely to develop severe illness or die than previous COVID variants, parainfluenza or the flu, so not good news. And I'll break down the data for you. Hospitalized children infected with BA.2 were 18 times more likely to be admitted to the pediatric ICU, 11 times more likely to develop croup than previous COVID-19 variants. They were also 3 times more likely to suffer a seizure caused by high fever than kids hospitalized with the flu, and 4 times more likely than children hospitalized with parainfluenza. Kids were also twice as likely to develop croup than with BA.2 than with the flu. And when it comes down to deaths, hospitalized kids with BA.2 had a 7 times higher chance of dying than children hospitalized with the flu, and a 6 times higher chance of dying than children hospitalized with parainfluenza. A lot of statistics, but the evidence is that it's not good, that they have a higher chance of hospitalization and more serious illness.
So, Doc, the children who passed away, were they vaccinated, and did they have any underlying health conditions?
Two important questions, Glenda, right? So like many places, Omicron hit Hong Kong very hard, and in February, with BA.2 spreading quickly, over 1,100 children ended up being hospitalized, and sadly, 4 of them died. Of the 4 children, 3 had been in good health, and they were quite young as well, 11 months, 3 years, and 4 years old, so heartbreaking. The 4th child was 9 and had muscular dystrophy. 2 of the kids developed encephalitis. That's a fancy word that talks about swelling of the brain. A viral infection most often triggers it. And now you asked, right, if any of the kids that died were vaccinated, and really none of them were, Glenda, but it was only last month that Hong Kong lowered the eligible age of vaccine from 5 years to 3 years of age. And since then, many parents decided to get their children vaccinated, especially since the 4 children that died in Hong Kong were the first to pass from COVID since the pandemic started. And that's an important fact. It just shows you that you never know when this will happen, right? Yes, the death rates, people will say, are overall are low for kids, but for little ones, there's really no treatment for them. To get monoclonal antibodies, a child has to be at least 88 pounds. That's another reason why I strongly support COVID-19 vaccines. And when my youngest son, who is 2 years of age, I'll vaccinate him against COVID once the FDA and the CDC says a vaccine is safe and effective for his age group. As I've said before, that's the way we get out of this pandemic and really be able to protect our communities.
All right, Dr. Nandi, thank you for your update there. If you have a coronavirus question for the doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter, and we'll get it right to him.